For the past few months, we've been preparing for the possibility of new variants by prioritizing vaccine and booster operations. These efforts have gotten us to an 86% vaccination rate for residents 12 years and older, the highest rate in the state, according to the Maryland Department of Health. Just this week, we ramped up our testing operation, adding our 7th mobile testing site and a new employee testing site. However, our systems are being stretched with the impacts of the current positivity rate of nearly 30%, with an average of 165 cases per 100,000 residents. Compare this to just a month ago, when our positivity rate was approximately 4% and our case rate was about 10 per 100,000. Our hospital currently has 63 COVID-19 patients in acute care and in ICU, compared to 7 patients just a month ago. And as we see nationally and statewide, this latest surge due to Delta and Omicron is overwhelming for us all. Many of our residents, families, workers are sick and may still get sick. Our healthcare workers, those in the front line, our EMS and paramedics are exhausted because they are working multiple shifts to make up for those who are out sick with COVID-19. This is true for our healthcare workers, our heroes at Howard County General Hospital, our county's only hospital. They have been sacrificing for our community, and we're so grateful for their partnership and collaboration for the last couple years. Throughout this pandemic, we provided $1.4 million to our hospital continue building infrastructure and for additional patient capacity, much like the overflow tent we're in today. It has gotten tougher, however, this winter. From mid-December to early January, Howard County General Hospital saw more than a 400% increase in patients hospitalized with COVID-19. As more and more of our community seeks life-saving care, we cannot lose our nurses, doctors, technicians, and other healthcare heroes. For this reason, today, I'm committing $2 million to Howard County General Hospital to address critical staffing needs related to this surge. These are investments in our public health system, which are vital to our health, well-being, and our quality of life here in Howard County and beyond. We provided more than $24 million in federal relief dollars to support private and public workers across industries, including our fire and rescue services, paramedics, EMS, who were asked to serve, care, and support our community while others were asked to stay home. Over this holiday season, while many of us were watching cases increase and determining if and how to safely gather, our hospital and health department were once again faced with exhaustive work that comes with a winter surge and a variant surge. And that's why over the holiday break, I was honored to provide $400,000 to our health department for critical needs pay. I want to personally thank our health officer, Dr. Mara Rossman, for being such an important partner. Howard County is grateful to have a resilient leader like Dr. Rossman. Healthcare workers on the front line have seen many of us on our worst days, and yet they still remain willing to help us. So please be mindful of the tremendous pressures our systems are having and the stress that that's causing. After 2 years, we are all tired of COVID-19. But we still have a responsibility to take the important actions to protect our community. Remember that we are still neighbors and we're all human. The circumstances we faced are overwhelming, but working together, being compassionate, being kind, and moving forward, we will get through this, and we'll get through it together. Thank you.
I'd like to first off start by thanking the county executive and the county government for their constant support throughout these past 2 years of the pandemic. I truly appreciate all of the great things that we have done as partners in this entire effort, and it makes me proud to be a Howard County resident. I know that there are limited resources and many other worthy requests for this kind of financial support. We are incredibly grateful to have received it. Like several other hospitals in our region, we have recently implemented what we are calling Critical Standards of Care Protocol, which is the standard of care framework that applies during disaster situations. We do not take this decision lightly. We have worked very hard to make the necessary adjustments to meet this growing demand of patients, as the county executive has just talked about, including converting additional beds to accommodate COVID patients, redeploying available staff to assist in these efforts, adjusting patient care models with high quality safety in mind, and transferring patients to other appropriate facilities. Yesterday, we had reached an all-time high in the number of patients during the pandemic, and earlier this week we had reported that we had approximately a 500% increase in patients who've been admitted to the hospital for COVID-19 since mid-December. This is a very challenging part of this latest phase of the pandemic. In addition to the number of patients and how sick they are, we have a much more limited labor situation now. Since before the COVID pandemic, we have had a 68% increase in the number of vacancies for jobs across the organization and a 10% increase in our attrition rate for these same employees. Like other hospitals in the region and across the country, due to vacancies, we rely on temporary or agency staff, and that agency cost has increased by more than 20 times since the beginning of the pandemic. So when we get funding like this, it is more and more critical to help us with these different types of needs. This funding from the county will help us with all of these staffing needs at a very, very critical time. So thank you again to my partners from the county.
Good afternoon. It's been a long 2 years and a challenging week, but what a way to end the week today. I want to thank the county executive for his commitment to support the public health system, our workforce, and our healthcare workers here in Howard County. And thank you, Dr. Ahmed, for your continued partnership. Investment in our workforce allows us to retain trained, experienced staff, which puts the Howard County Health Department in a better position to serve our residents. Much like the healthcare heroes at Howard County General Hospital, our public health heroes have been working around the clock for more than 2 years in response to this pandemic. Local health departments have been thrust into the public's awareness like never before and have answered this call with relentless work to provide guidance and education to the community on how to stay safe and healthy while facing this new virus. The funds provided to Howard County Health Department have been utilized for additional remuneration to support staff who have been performing critical work during our ongoing COVID-19 response over the past 2 years. Just as Dr. Ahmed mentioned, we too have workforce issues. This work that we've been doing includes the massive undertaking of administering nearly 125,000 COVID-19 vaccines, standing up weekly testing clinics, working closely with county schools, nursing homes, businesses, and other congregate settings to mitigate the spread of COVID-19, and answering thousands of phone calls and emails from residents. Much of this work has been performed by staff who continue to provide other public health services to our community. Our work on maternal and child health, behavioral and mental health, healthcare access, reproductive health, food safety inspections, and many other programs continue throughout the pandemic. In closing, because it is a Friday afternoon, I want again to encourage everyone to get vaccinated and get their booster shot when eligible. The vaccine remains our best tool to protect against severe illness, hospitalization, and death. And let's stay out of this room, right? Thank you for your support as we continue our work to promote, preserve, and protect the health of everyone in Howard County. Thank you.
COVID-19 and its variants have placed an extraordinary amount of strain on our emergency personnel and our hospitals. Our department, like many others, is not immune to the effects of this pandemic. As of this moment, 20% of our employees are unable to work due to illness. Our workforce has felt the impact of this virus from day one. We've had to come up with creative solutions to alleviate the stressors we're experiencing, such as utilizing day work personnel to supplement field staff, create EMS surge level protocols during peak times, triaging patients, and sometimes transporting patients to alternate destinations. And while field operations are the #1 priority, our departmental initiatives have also suffered as a result. We hope that the funding will provide new opportunities to assist our overwhelmed healthcare system as we look forward to continuing to work together with Howard County General Hospital and the Health Department to provide the best possible service. As always, if you are having a true medical emergency, please do not hesitate to call 911. We will continue to deliver the highest quality of care and meet the needs of our customers despite the circumstances. We appreciate the patience that the community has shown us, and we are thankful for your constant support. Finally, I would be remiss if I did not thank the providers from HCDFRS and the staff at Howard County General who have shown up, spent countless hours away from their families, and given their all for their patients during these trying times. Thank you.
Thanks, Chief. Now we'll open it up to the press for any questions. Okay, this is a question for the executive. Go ahead. Can you ask the question, then I'll repeat it so our people on Facebook can hear it?
We was just over to the school a month ago when you was opening up a sanitary or testing. Personally, you guys was leaving the county and leaving the state with numbers down, with vaccinations, with providing everything. How do you feel to see that they're going back up, knowing that you did all you can for this compared to that?
Given that Howard County is leading the state in various metrics and has been doing a lot on the forefront of the pandemic, how does it feel now to be where we're seeing increases in cases?
I mean, honestly, not only is it concerning, it's frustrating. Not only these healthcare heroes, but my team has been working almost non-stop for nearly 2 years. And here we are, still in the midst of fighting COVID-19 and still seeing so many of our community members in harm's way. However, I remain hopeful. I know that this is a race, vaccine versus variants. And if we can all get fully vaccinated and boosted, we will beat COVID-19, and we'll make sure that future generations look back and see that this was the time that we made the world a better place by making sure that we took care of this virus.
Sure. There's a question for Deputy Chief.
No, I'm sorry, the chief was absolutely.
Okay, for Dr. Ahmed from the,
Doctor, yes.
yep.
You get $2 million. How do you stop other hospitals competing against you to take your staff? I mean, I know this will help to keep them, but what are you doing? How are you talking to them? Give them time off. What is your plan, and how are you going to use this?
While you're receiving $2 million in critical needs pay, how are you working to mitigate the competition against other hospitals?
So I think my answer is that what we've done in the past 3 to 4 months is we've taken a look at all of our salaries and made them more competitive. We've increased rates so that it's consistent with people in the area. So if they want to leave, it's because they want to be in a different hospital. not necessarily because the rate would be different. So we've started working on that as well. That was something that was unanticipated, but we've risen to that challenge. And in some areas, we've risen the minimum of wages to $15, which were, for some people, under that as well. So I think those things will help us.
Sorry for dominating, but I got a
No problem.
question for the young lady who's the doctor.
Okay, Dr. Rossman, our health officer.
Sounds like a plan, yes. Last time I talked to her, we met, we was talking about kids, not just kids going back to school, but the smaller 5 and below kids. Is there any plan on how, a lot of parents talk to us all the time, what do I do with my 8, 9, 10-year-old kid goes to school, but comes back home with something, and I can't get my 5 and below kid with shots.
Right,
So there's
okay.
something to do about it.
Sure. Right now, the question is to Dr. Rossman. The question is, while there is vaccine available for the older kids, what can families do given that the 5 and younger are unvaccinated?
Good to see you again. So we'll start with the vaccination that we've all mentioned. So if you have a child that's under the age of 5 and not yet eligible for a vaccine, the first thing that you should make sure is that everyone in the family who is eligible has not only their primary series, but booster shot. You are creating a bubble around your loved one who's not able to be vaccinated, in this case, your 0 to 4-year-old. The second thing to do is use masks when you go outside or inside rather, in public places. And make sure if you have a child that the mask that they're wearing is well fitted, comfortable, and one that they'll keep on their face most of the time, if not all of the time. Things.
The same question to the executive, I gotta call him doctor, but you guys work together, the same question to you that I did to him. I'm asking you the same question. I asked him, well, how do you feel to see your numbers rise? If you was leading the state in a good way, how do you, I was asking her the same question. How do you feel as you guys are talking? How do you feel to go, like, you know you were doing the best you could, and the numbers went down? Same question, how do you feel?
So one, it's disappointing, huh? How many times have we thought we've finally gotten through a wave and we were seeing the light at the end of the tunnel, only to have another wave come our way? And right now we're seeing higher numbers than we did a year ago. So at best, it's disappointing. But Angela used a term to describe me as resilient. And when I have a battle or a fight or a challenge, I'm not going to give up until we figure out what are the best strategies. And it's not just me. You have almost 300 public health professionals, heroes behind me, who 7 days a week are equally resilient and passionate to figuring this out. And as Dr. Ball says, I think every time I see him, we will get through this. And we just have to believe and keep on doing the things that are recommended.
But does it also take a leader? I mean, you guys obviously have been conversation all the time. A leader to listen to you, because obviously he must be listening and taking advice. Now he's giving, I mean, I say he, but the executive office is giving money. How important is that to have someone supporting the science?
First and foremost, I'm really privileged to get to live, work, and play in Howard County, which is known to be on the forefront of just about everything, and believers and educated in science. And I have an incredible privilege of now serving under Dr. Ball, who believes in public health, who believes in science, who puts his money where his mouth is, right? That's what we're talking about today. And also with the professionals here at Howard County General, who, for the time in Howard County, 12 years I've been working with, they are they are in step with public health all the way. So that makes my job easy. It makes it easier for me to wake up in the morning. And even coming today to see my friends and colleagues here, they are my friends and colleagues because we support each other.
Thank you. Given that there are no more questions from the press, we want to thank those who have joined on Facebook, and thank you for joining today. Happy Friday.